Hotspots. And I'll turn it over to you, Scott.
Great. Hello, everybody. Good morning. I hope you've been getting sleep over the past few days. I was one of those people who was like nonstop checking the results of the recent election, but yeah, so there's some relief that I don't have to do that anymore. Let me see. So this morning, let me go ahead and share my screen. I recognize some people out there from the racial equity group and elsewhere. So nice to see some familiar faces. I'm going to go ahead and share my screen. I was looking at the other breakout sessions, and I feel this one may be a little bit different in that it's kind of quantitative focused, and also uses particular software packages. So I assume that by registering for this or showing up for this particular session, you have kind of interest in getting into the weeds with some of these, or maybe you already have some experience with some RStudio and QGIS and those sorts of things. In fact, I'm wondering if it's possible for those who do have experience with RStudio or QGIS, could you raise your hands? Can I see that? Let me see. Actually, I don't know if I raise your hands with a, okay. So, okay, not everyone is showing up, but okay. So it sounds like it looks like there are a few. So let me share this again so I can see. But we're gonna go through, I kind of changed the name of it. I renamed it to Spatio-Temporal Analysis of COVID-19 Hardship, Vulnerability, and Disparities. I removed mapping, although we're going to do a fair amount of mapping, but really looking at the various data sets that exist. Again, Priya mentioned that I'm at DePaul, I'm at the Chaddick Institute, and typically, well, maybe pre-COVID, my research was mainly on urban planning and public health related, but more dealing with environmental pollution and things like that. And it wasn't until COVID that I started looking at infectious disease and using the types of data sets that are available to examine that and the types of analyses. But I'm thinking for today, we'll start out just with a general talk about public health equity from a quantitative perspective, kind of what this session is generally about doing. The ingredients needed to do this sort of analysis, and then we'll focus on these particular tools, open source tools, RStudio and QGIS or Quantum GIS, and then we'll go through a few exercises and then have a formal Q&A at the end. But I want to encourage all of you, if you have questions, if you have comments, if you want to just share something related to what's being presented, we have a nice kind of small group. Feel free to just unmute yourselves and ask a question. I think it would be nice just to make sure I'm speaking to what your interests are. So, and yeah, so beginning with just population health equity from a quantitative perspective, I'm thinking that, generally what we're trying to do is identify differences in health outcomes among different subgroups in the population. And this could be related to, race, ethnicity, this could be gender, this could be socioeconomic status, but really begins with identifying differences. And then from a spatio-temporal perspective, it's trying to understand whether, or identifying whether or not there are changes over time and geographically. So that would be, in terms of both the outcomes and the population subgroups, like how are these dynamics related to one another? And then I guess the logical next step is then try to understand, well, what predictors help explain differences in these relationships between subgroups and health outcomes? And then, given that we're all wanting to make change in the world, the next logical step would be to inform policy with that knowledge. Today, we're really going to be focusing on these two initial steps, which is trying to identify, using data to identify differences in health outcomes between groups, and then how they vary or change over time and space. So the ingredients. First thing we need is the actual population and health data. And, maybe this isn't a lot of what I see is the breakout sessions, and even with Adam's talk, which is, really profound, deals with a lot of this kind of like embodied activism, embodied experience with health equity. And I think the challenge here is, working with a lot of this data from, that are more formal empirical data sets that are in the, that you're using a lot of computation. It's almost a disembodied sort of activism, where you're behind the computer screen a lot. And granted, we're all doing that now. But there are a lot of different sources for these data. In terms of the subgroups, like the population segmentation, a lot of that is from the US Census. So the American Community Survey, the decennial census. We have the Bureau of Labor Statistics for economic data, the EPA for various sort of environmental phenomena. And in terms of COVID, the Illinois Department of Public Health, aggregates a lot of the information at the, at the state level, and then the Chicago Department of Public Health, City of Chicago, and so on. And the ones highlighted in red here are the data sources that we'll be using in our examples, in our exercises today. So it really begins with, where do we get our population and health data? How do we segment those? And then we can add kind of the containers. How do we look at these from a spatial perspective, a geographic perspective? And a lot of this is, political boundaries or arbitrary kind of data boundaries, like the census tract or the census block group. But most of these that are used in public health equity sort of analyses at a broader scale, trying to understand like comparisons between places, primarily from the census tiger data. So I'll show you some ways to use that data to access it and how to visualize it and really combine it with this population and health data. I have OSM on here twice. I noticed that's OpenStreetMap is another great source for some of the geographic information. And essentially anything that has X and Y coordinates, geographic coordinates, there are a lot of transactional data now that can be used for public health equity. I'm doing some research on the use of scooters and walking, and anytime you have this transaction, especially in the shared mobility space, you begin to, essentially it's behavioral information, and able to see how those variations, if there are variations between various subgroups and geographically. So there's a lot of more data out there, formal data sets, these transactional data sets, or more organic data sets. The next step is to visualize, to use this combination of population health data with the, that are organized into geographic compartments, into, this visualization kind and also data wrangling. I say here, you know, there are a lot of things that you need to do. You need to access the data, process and oftentimes clean the data, and then visualize it. And that's one thing I really like about geographic information systems and some of the tools in R is that you can begin to really visualize, you know, these patterns and identify kind of the sorts of changes and differences that we're hoping or detect them. So the visualization and having it, and I think these two tools, RStudio and QGIS, are just very powerful first step. So I'm not going to go, I don't, if you don't have experience with RStudio and QGIS, that's fine. This is really more of a rudimentary introduction, you could say. But those of you who do have experience, I'm hoping that you are also benefit from this, in that you may not have utilized some of the tools and packages that I talk about today. But I'll get more, I'll talk a little bit more about RStudio and these package applications soon. Okay, so there's a lot of precedent for these sorts of analysis from a public health equity perspective. Some of these early studies you may have covered if you were in maybe your early public health courses or epidemiological courses. This is an analysis that goes back to the early 19th century, looking at neighborhoods within Paris. A French epidemiologist, Viermy, and I need really help with my French, but looking at how population and mortality rates differ with the essentially a proxy for wealth, which is the percentage of untaxed rents. And essentially what you see here is as the percentage of untaxed rents go up, the annual mortality also goes up as proportionally. So you have the poorest areas versus the wealthiest areas. So thankfully, we have, as I mentioned, a lot of data sets available that help us do this sort of analysis, whereas back in the early 19th century, you're having to collect a lot of this information on your own. So most of the data I'm going to be talking about are from these secondary sources. Another example is John Snow's cholera map. You may be familiar with. Geographers always point to this, and epidemiologists point to this as kind of an early example of how exploratory data analysis can show patterns once you start mapping it. Started looking at cholera cases within London. There was a cholera outbreak at the time, and started just plotting where the cases tended to be. And that's where those black kind of dots are on this map, and the location of the fatalities. And through that, it was able to identify through kind of analysis of shortest distance that they were all of the people where essentially where the outbreak was were nearest to a certain pump. And without this sort of geographic analysis, maybe it would be difficult to identify that pattern. Granted, this study and the results of it really didn't change policy at the time. People still didn't believe that it was from the water, essentially, where people were contracting cholera. But we still have to do our best to get kind of systematic information, important information into the public sphere to inform decisions. So a lot of times, it's, well, we saw it with the election with the polls. We do our best, and it's not always perfect, right? But doing the best we can with our analyses, making sure the data are collected and analyzed in a systematic fashion can really lead to interesting insights. Now, some of the data, I was mentioning the geographic information, before we get into the applications themselves, I just wanted to give a brief overview. You may be familiar with census geographies. Some of them are organized in a hierarchical fashion. There are counties which are composed of census tracts, which are composed of smaller census block groups, which are composed of census blocks, which is the the smallest, the most granular of the census geographies. So here's kind of another depiction of this, where you have the hierarchy going from the national level to the states, to the counties, to the census tracts, block groups, and blocks. Some of the data aren't part of the formal hierarchy. They're a little bit different, and we'll talk a little bit about the challenges of that. But like cities and municipalities, you'll have census tracts that maybe overlap boundaries of municipalities. You have zip codes, or ZCTAs, zip code tabulation areas, which also don't fit neatly into this hierarchy. A lot of people are more familiar with their zip code than their census tract, though. So there's kind of a trade-off of how we organize and what geography we select for our analysis. You probably don't know your block group, but you may know your zip code, or in Chicago, you probably know your community area. So, when it comes to the scale, or, the units of analysis we choose, it kind of depends on the audience and who you're communicating to. We're going to be using for the exercises, counties, census tracts. We'll mention community areas, and also zip codes. And some of this is also, you're kind of limited to the geography that the data are initially collected in. Like much of the COVID-19 data at the city level is collected at the zip code. And that's really just out of ease of data collection. People, families are, again, more familiar. They know their address, they know their zip code, don't necessarily know their census tract. So it's just easier to collect information at that level. Okay. Now, I'm going to just mention a few other things here. I talked about population data and population subgroups, and how important just the American Community Survey and the census is for collecting those. This is a framework that put together with my students as part of exercise and kind of formalizing, what are the dimensions of COVID-19 vulnerability, or vulnerability to experience hardship that's related to COVID-19. So we looked at it in terms of these different dimensions, like, say, vulnerability to experiencing severe symptoms or hospitalizations, older age groups, households without health insurance, gender and race, and through various reports suggest that these subgroups are experience essentially vulnerability or experience hardship differently. So we can look at it in terms of this dimension. Another dimension is how people interact or move through their environment. So the vulnerability of COVID-19 exposure and transmission, essential worker population. You just have essentially potentially more frequent interactions with individuals, so your risk probability may be higher. People living in group quarters, assisted living facilities, in prison populations, and so on. We've also seen public transit ridership has shown to be an important indicator too, explaining variations in COVID-19 infections and so on. So all these you can start to look at, and what's interesting here in terms of identifying these subgroups, all of this is from the American Community Survey. So I'll share with you some tools where you can create these dimensions fairly quickly using R and the latest census data. Okay, this is showing at the county level how how these dimensions are the variation in these dimensions across counties, also separated by the health areas within the state. So you can, each of these a component of a broader composite score. So the black and white images are showing patterns of age, race, percent with no health insurance, the gender share, and then these are combined into a composite score. And then you can go the next step, and this is essentially by county, the composite score. And then you can go to the next step to identify hotspots, statistically significant clusters. Where are the cold spots? Essentially, where are low rates of all of these individual or composite variables versus clustering of those that maybe score high within each of these component scores. So you can begin to look at that. And this is by census tract. So it gives you an idea of going from county level to census tracts, kind of the fineness, change in the change in the both the number and the fineness of the granularity. Exposure and transmission, this is kind of the same thing, looking at the individual factors combined into a composite score, and then looking at it at the census tract level in terms of hot and cold spots. So this is more vulnerability. It's not COVID outcomes, but it's more vulnerability to experience hardship. Okay, I'm going to pass through this. So let me start off, because I think most of this is going to be, the idea is have it be more hands-on and applied, kind of moving through the software packages themselves. If you have experience with RStudio and QGIS, feel free to open them up, and you can work through this, except I'm thinking, Priya assured me that this is being recorded. So if you want to just watch for now, and then you can work through these exercises on your own later at your own pace, may be a good idea, just so we don't have to slow down so much. But by all means, I want to encourage you, if you have questions at any time as I start to go through the applications themselves, you can, again, what's nice about these programs is that they're free. You can go to these URLs here and download them. They're cross-platform. You can download, if you have a Mac, if you have Linux, if you have Windows, there are options for each. The other, and maybe I should share this on the chat. I do have some R scripts that I'll be working through RStudio. Those are available on this Google folder that I've made available. So maybe I'll share that through the chat function. But before I go on to kind of the working through RStudio, does anyone have questions? Okay. I'm going to chat this link out very quickly. Okay, so you can, if you want to download the scripts, you're welcome to do that there. Okay, so let's go ahead. So when you download RStudio, this is what it looks like. Okay, so this is the interface, and on the left side, you have a console for writing your commands. And so I apologize in advance if, kind of this coding work isn't something that you are accustomed to or want to see. But we're going to be kind of working through the RStudio platform. It's fairly for a fair amount of the time. And then over on the upper right here is the kind of the environment where, as we create objects, they'll appear here. including things like tables. In our studio, they're described as data frames. And then down here is more of, you can view on the bottom right, you can view files as well as some of the plots that we'll be going through. So the first activity we'll go through is at the state level, downloading some COVID data, working with some geographic information. And the first thing I'm going to do is actually create a new R script. So you'd go to File menu, New, and then from here you can, it's essentially put in code, any functions you want R to execute in this area. And I'm going to go ahead and save this file so I don't lose anything. Find a place for it. Okay. I'm actually just going to put it here, Illinois. Okay. And what's great about both R and QGIS is that it has a very strong and growing user community. And people put together very useful tools. In fact, there are a lot of COVID-19 extensions or add-ons or packages in R that you can access. I'm not going to go through those. They seem to be always changing and improving, but it's great. Actually, I took a class through the University of Washington on epidemiological network modeling this summer, and they have some amazing tools called Epi Model, a package that's available through to use through R. So some of the packages are very simple. They may just have a few algorithms that are really useful. Others provide a whole suite of applications or a suite of tools to achieve something. So these are the packages that I'm going to be using for this first set. To install or activate a package in R, you use this, refer to your library, and here are the names of them. If you go online and do a search and like dplyr R package, you'll see a lot of information, some documentation on that specific package. If you want to install, I'll just give you a from scratch, a new package, you go to this packages tab, and here you can say dplyr, and it'll show up, and then you just install it. So there are literally thousands and thousands of these, and it becomes kind of your decide through trial and error which ones are the most useful for you. Now, when it comes to geography, I find this package called Tigris is wonderful. I mentioned the tiger data through the census. What you can do with this is, I'm going to write a couple of commands here. Okay, so to download various census geographies, this is using the Tigris package. I'm first of all going to select all my packages here and run them, and that'll activate them all. You can see what's as it runs them in the console. So it'll just, essentially I have them installed, it's just now R is activating them. But let's say I want all the counties in Illinois. Well, with one line, you can run this. Of course, I has to do this. Yeah, sometimes you have to put in a year. But by default, it should choose the latest year. This gets to, I'm sure if you use some of these open source programs every now and again, I was hoping the glitch would happen like 90% of the way through our lessons. It happens on the first command. But anyway, I did successfully download our Illinois counties, and you can see there are 102 of them It has some standard, variables or information about each of the counties within the state. But with this, now with the SF package, it's the simple feature package. I can actually map these in R just by typing in this command of plot. And that will show up here. So what this did actually is used each of the variables and by default used kind of a categorization color scheme for each. The only one that's really kind of meaningful, only two that are meaningful here are the area land and area water, showing, well, the counties with the greatest water area are along the coast, Michigan here. And the area land is also expressed kind of thematically in choropleth. But you can do this with all sorts of different census geographies. So let's say you wanted census tracts for the state. Instead of counties, just type in tracts. For Illinois, I'm going to use the default here, so it takes in the latest. Okay, and now let's, instead of mapping tracts, I map counties. And here, let me type in area land, so it's only mapping to one. Okay. So as it's working through this, we have how many counties, how many tracts do we have? We have 3,121 tracts throughout the state. So again, this is an easy way to begin to essentially access geographies for your analyses. Actually, what I was wanting to do is this, and it becomes a little easier. I'm going to say area land. If I specify, it'll just plot the one. Okay, so now that we have geographies, like to say counties and tracts, we can start to do some analyzing of these geographies. So let's say with the counties themselves, some things, unfortunately, the area land is, the units are in square meters. So if you wanted to create a new variable, like have it converted to square miles, then you can run this command. And this is using the dplyr package, where you're essentially taking the Illinois counties data frame here, which is our kind of our data frame with geometry. And we're adding through this mutate function a new field called square miles. And it's essentially taking the area land and converting it from square meters to square miles, and air water from meters to square meters to miles. And then we'll just add this new variable. So now you can see we went from 10 variables to, I'm gonna do this again, to 11 variables, and the square mile variable has been added. You can create tables pretty quickly by, say, let's organize this. Let's list all of the counties and summarize it by square miles. So here we have Cook County showing 1,635 square miles. You can do maybe a Google search to see if that's correct. If it isn't, let me know. I think that's right. Yeah, so there we have it. A nice tool also is something called Clipper. And I assume that you probably use not only R and other sorts of analytical packages, but you may use just Excel as well. So with this, you can let's say you wanted to add this to your clipboard. So you can say, I'm just do a table. I assign this table by name of county and total square miles to a variable name called table. And then I add that here, right clip, and then see how it executes that. Now, if I go to Excel, I can paste that in here. So the point here is with almost all of the functions we do here and the analyzing of the data, we can easily get into Excel or other programs just with a simple right clip or writing to a CSV or those sorts of things. So let me get into some of this COVID data initially. And I think the real wonderful part of R is just the ease with which you can move from application to application, start integrating data. So you may be familiar with the Johns Hopkins University dashboard. Let me look at this online. Okay, so through here you can see trends in terms of case rates, or arranged by country and all of this, and tracking cases and deaths throughout the world. There is through here though on the GitHub page, there's a link that you can go to that has the data behind what the dashboard. And what's nice about this, here we are. If you go to CS COVID data, if you want to bring this data into R, it's actually relatively easy to do. So we go to this time series, and you can see it has updated 10 hours ago the confirmed cases and deaths and recovered for globally. Now in R, what we can do is take that link, and I'm going to just run this single line, and it's pulling in data from the Johns Hopkins website. And here it's been added. COVID cases data by county. And then I'm going to do the same thing with the deaths data. Okay. So that one. The only problem is, so we've added 2 of these tables into R. The problem with it is it's really, really ugly in terms of its format. So this is where the data wrangling, if you click on this, let's open it up. You can see the various fields and the records. There are 300 variables going across, and each as I move over, as I scroll over, you can see it's for each day beginning January 22nd, 2020, and it goes all the way to the present day if I were to scroll all the way over. The other problem with this is that it has, so it's in this form called the short form. It does have, the coordinates of the administrative unit. If you're looking at this from just a US perspective, then the administration area is actually the county. So there are lots of things that make this a little not so user-friendly, but it's easy in R to change the format of it and make those columns that begin with X and the date, make them actual date type columns or date type records in the data. And then you can start looking at things from a temporal perspective. So what I'm going to do here is change this form of the data from a short form to a long form, essentially putting all the cases and dates into a single column rather than this as separate columns. Let me do this here. Ooh, I can't find gather. Oh, I think a tidier. I think I forgot to add tidier. Another package that's needed. Okay, so what it's going to do is now I have 965,260 observations, but only 13 variables. So it created what's called a long form. And here it is, we have the date column and all of the dates. The problem is the dates aren't formatted properly, and R doesn't recognize them as dates because it's a character field. So we're going to go through these very quickly. It's kind of some wrangling. You can use this yourself. And I've changed some of the names of the columns. And now let's start to look at these. Okay. So, and also what I'm going to do is only pull out those cases or those records for Illinois only. The other thing I'm going to do is, before we start visualizing the information, is create some lag variables, like how things have changed over time. And there are some tools in R, such as that allow you to, let's say, pull very quickly something like using this lag function, the cases 1 week ago. So the 7 would mean number of days, and or maybe a day earlier, cases 1 day or earlier, and you can organize those by county. So I'm gonna run that. Okay, and then the other, now we can start to plot the data and see what it looks like. So this is the latest COVID information, just a simple plot of cumulative cases. Or we can look at it in terms of if we subset out the it's state code 17 and county code 031, you may know that identify that as Cook County. So this is looking at Cook County. We can also look at it in terms of how, in terms of all of the counties within the state and their trajectories. So here we pulled out only those counties that have had, what did I put in here? Cases over 1,000. And you can see what their trajectory is over time. And here are the, using a similar X and Y scales, X and Y axes. And you can see DuPage, Kane, Lake over time. Another thing we can do is make these more interactive. Let's say, do this again. This is actually looking at changes over time. See if I can. And by using the package called Plotly, you can interact with the table, the chart as well. So we're looking at, okay, on the y-axis, new case or cases a week ago, versus down here on the x column, x-axis, we're looking at date. So what were how many new cases did you have over the past week? And you can see the variation over time. And we're not having a good couple of weeks here. We've had, over the past week, we've added 21,000 cases. So definitely on a big upswing, right? So it makes the data, not only can you just view a static chart, but you can begin to interact with it as well. Okay. Before I go on, I know I just kind of went through this relatively quickly. Are there any questions right now? Is there something you'd kind of like to see in the, or wonder in terms of the capacity or the functionality of R with maybe your own work and what you'd like to do? Can open it up for any questions you have. Okay. Another thing we can do is begin to plot information by and looking at it in terms of an interactive map. So I'm going to actually run all of this. There's a function called leaflet that allows us to use have interactive maps within R. But I find that using QGIS oftentimes is a little more user-friendly. So let's just go to, given our time here, we're at about 10:28. Let me show you something else we can do. Using information from the Chicago data portal, we can look at time series information over by, say, and I guess that data would be by week. Those of you who have used QGIS, you may be familiar with the interface. Here's how it's structured, how it's laid out. You have an area for layers, and these would be geographic layers. You have an area to visualize your map, and then you have kind of a browser here similar to Windows Explorer, where you can navigate to your data. What's nice about R is that you can use a function called STWrite, and let's say we have our counties here, or census tracts. You can save them out as shapefiles, which are easily readable within QGIS. So once you export, say, the county data or the census tract information as a shapefile, you can then add it as a layer within within QGIS. So I'm going to navigate to a couple layers that create here. One was, this is data from the Chicago data portal. And the way the city collects, actually I'll go to here. The way the city collects the COVID-19 cases is by zip code. So you can see daily COVID cases, and then this one, COVID-19 cases, tests, and deaths by zip code. I essentially used a similar process in R to download. In fact, that's one of the scripts that you can use that I put on the Google Drive to make this zip code map. And from here, what you can do is use a tool called time management as a time manager, as a plugin to begin looking at time series maps over time, or how, say, cases, case rates, and those sorts of things have changed over time. So the first thing to do here to make the data meaningful is to change the symbol type. And in QGIS, what we're going to do is create a graduated data type, and then go to, in this case, I'm going to use value. And let's see, I'm going to do two things here. I'm going to duplicate this one. And if you can look at the tables here, what I've created is several layers. One has positivity. We also have case rates, and we have a start date and an end date for each, which allows us to begin to visualize these over time and the value of the positivity rates. So what I'm going to do here is actually select out some of these. So we're only looking at positivity. So I have to do, it's called a filter. Layer equals, let's look at positivity. Okay. Okay. Now I've essentially only have positivity in the data set now. And then if we map these by that rate, let's say by using a graduated and quantile function. So we're saying these are our bins here from 0 to 2.5 or 2.6%. Each of these it'd be quintile categories, has the same number of zip codes. I'm going to use a dimensions map. Dimensions usually from blue to red, and apply that. And what this does is essentially show you the positivity rate for every single week beginning in January. And we're kind of looking at the latest week here, but if we use this tool called Time Manager, we can begin to look at it over time. So let me go to the settings. I'm going to add this layer called positivity rate and use the start date. We also have an end date. Click here, and then time display options. That looks good. Click OK. And now here on the bottom right, you can see the date, and you can start to scroll through here. You know, in January, I mean, we're looking at March, April, and the red is suggesting that this is the highest rates throughout the entire time period. So in the quintile, so is it, you know, at this time, you're looking at some of the highest rates we ever had in terms of positivity. And we can label the zip codes or even add a base map here fairly easily. I like the ESRI kind of minimalist background, but there are a lot of tools, a lot of, you know, so we can adjust the transparency. There are a lot of cartographic options you have here, like label the zip codes or the community areas. But we can look at this over time and see where we are, let's say in June, August, September, and what's the latest we have here? Yeah, it looks like we have through the 31st. But even through that, we have some areas, some zip codes on the west side and a couple on the south side, and also up here, that are experiencing some of the highest rates in terms of quintile, you know, essentially highest 20th percentile, above 17.6%, even, you know, essentially right now, over the entire period of the Chicago COVID crisis. So you could do this same sort of thing for every metric. You know, in fact, we're looking at it in terms of infection rates, mortality rates, and then you can start to look at it also in terms of how it breaks down by race and ethnicity. Okay. Are there any questions so far? I can't see anybody, but I'm wondering if you have any questions about how you may use these tools just as we've seen thus far, or if you have questions about what is possible and what's not possible.
There is one question in the chat.
Oh, okay.
They're saying that they found it difficult to find info by community area, and if you have any suggestions.
Yeah, yeah. One way to go about community area. Well, first of all, you can get the geographic boundaries through the data portal by community area, but there are community areas are actually aggregate down. I guess census tracts aggregate up into community areas. So if you have census tracts, you can, your data organized that way, you can easily aggregate up into community areas. So that's probably the best way. If there's a particular data set that maybe that you're interested in, you can unmute and maybe ask that question. If it's COVID specific, yeah, getting data by community area is a bit difficult. You would have to have begin with a lower level of geography and then aggregate up. And I know the Chicago Department of Public Health has made some of those data available for research purposes, but unfortunately, most of the data are provided at the zip code level. Often what I do though is in the mapping, you know, to kind of give people an idea of, you know, what, you know, how does zip codes relate to community areas. Sometimes I just map the or display the labels of the community areas. So in QGIS, you can add labels, single labels, say community area. And let me get the size. And I'm just going to actually make the boundaries, you know, remove the background and the boundaries of the community areas. But this way, you know, even though you're displaying the information by zip code, you can still see on top the labels of the community areas. Another thing, a way I've kind of gotten around that was to look at the percentage overlap of the zip codes to the community areas, to let people know, say, well, the majority of the zip code is in West Englewood or something like that. So yeah, it's not necessarily an easy task, kind of limited to the way the data are initially collected. Are there any more questions about this sort of thing?
Yeah, there's one more in the chat. They're asking, are there major problems with using zip codes to map geographic areas?
Major problems? The major, I guess the only real issue is there are several, there isn't a there isn't a clear, or I guess universal zip code geographic layer. In fact, the United States Postal Service has their own zip code layer, which may not correspond to what the census calls their zip code tabulation areas. So it's not a, I guess you could say a universal geography. So that's one of the downsides of using zip codes, is that I think even UPS, USPS, a lot of them use different different boundaries and update them at different different cycles. So with the census, for example, they update their zip code layer on an annual basis. But given we have, development occurring at different times, all the time throughout the country, zip codes appear and disappear more regularly than the census actually updates their tabulation areas. So that's a downside. Yeah, so yeah, that's a good question though. One of the other downsides is that, people may not be real familiar with zip codes other than their own. So when you start to compare, it's easier to compare municipalities. People have a good idea of those, as well as the community areas in Chicago and more commonly held geographies. What I wanted to do as a kind of a second exercise was use the, let me see here, show you how those vulnerability indices were created. Now in, actually, let me go back to our initial one here, because I haven't mentioned how you get census population data into R. It's almost as easy as you getting the geography into R. There's a package called Census Api. And what that does, I don't know if any of you use the American Community Survey on a regular basis, but they've just transitioned from one website to another website, and it's not very user-friendly. So oftentimes when it comes to, identifying the data you need and getting only the variables you need, it's not so clear, or it takes a lot of clicks to do it using the GUI that's available online. So through R, and actually through the US Census Bureau, they've made available a lot of these APIs where you can do a data call and essentially get only the information you want. So I'm going to give you show you how that works. There's one thing you can initially do is just get a list of all of the American Community Survey data tables. So I'm going to run this line of code. And in my environment here, it's added this new table. And this was collected from the US Census when I ran that using their API. And if I look at this, you can see it has every table in the American Community Survey and the table name. And if you were to click on here, use this URL and put it in your browser, you'd see all the variables within that table. So let's say, we have our race table and different iterations and imputations here. So, and you can, in R, you can filter this out. Let's say you're interested in income. Then it'll identify all those tables that are related to income. And you can easily find this. Now, this is just the table. It doesn't have the data. What you have to go back and let's say, now that I've identified a table, let's just use, the sex by age. If you were to copy that table name, bring it back into here, and say, I'm interested in all of the variables within this table. So you would run this code with the table name. And then you see here, brings it into, oops, wrong one. This is the variables. And now you see for that table B01001, these are all of the data that comes with it. You have the total, you have male, female, you have by age group, you know, again, this isn't the data, it's just all of the columns associated with, but by knowing what columns or attributes you're interested in, you can copy those and essentially make a list and only get the data you need. So for example, here, I'm just going to get the population data only by county for our state, which is Illinois is FIPS code 17. I'm going to run that. And then here we are. For each county, I have just population. Now you can do that for every, any variable that's of interest to you. So it's a very quick way, rather than going to the, the graphic kind of all the forms online. You can just pick out the attributes or the population, housing, essentially all those other items that we were referring to, percentage of population who has no health insurance, poverty, all those sorts of things. Just get the variables you need very quickly into R, and then you can put it into Excel or what have you. So let me see here. And I was mentioning that with the vulnerability indices that we created, I put on the Google Drive all of the different this script, which allows you to download all at once the information that was used to create those indices. So there's it uses this combination of tables, and you can see tenure in your household by vehicles available, because we have the transportation, whether or not you have internet, workers by industry, and we use this to create an essential workers layer. If you were to run all of this, you can get it at the census tract level, at the county level, block groups, and all of this to create essentially a COVID-19 vulnerability index. So feel free to use that code. Again, something you can build on or modify. If you have questions about it, you can shoot me an email. But the idea here is you can easily create your own variables. So for example, here, let me look at essential workers. All of these, it's essentially combining those. This variable here would be essential workers. It's combining all of those occupations and industries, frontline healthcare workers, food occupations, other sorts of that were identified with, at the state level and the federal level to be essential. Essentially, you can download those fairly easily and then start to compare them across your various groups. And then also look at it in terms of COVID-19, outcomes. Let me do, let me see, we just have a little, because we end just in not too much time, right? I was hoping to get go through a lot more here, but maybe we open it up for additional questions now. Do you have questions about resources for R or for QGIS? I was going to mention one other thing. Feel free to unmute yourself and ask a question. But we're creating a set of dashboards essentially that allows for the visual analysis and kind of this spatio-temporal mapping at various levels for COVID hardship, different rates, including case rates, mortality rates, and so on. So you can use this just as an online tool. But what's interesting about it is that I'm using RStudio, or R program, to update it on a regular basis. So R is great as a desktop tool, but it can also be used as more of an enterprise tool to do your analyses and then serve it up to a web page you may have. So here, I'm using a lot of these same algorithms in R to create the data that is then mapped and served on this website. So we're going to have a formal kind of pilot of this dashboard out early next week. But what's nice about this is that if, let's say, we're looking at case rates, if you were to, let's say we can select a community here, and it will update the profile of that community in terms of the various variables here. And also, as you choose, let's say here we're looking at death rate, you can look at it different for various weeks of the year. It'll update you, show you what it looks like at the average infection rate for that week. And yes, it can also select this table to see where are the highest rates, and it'll flash that zip code on the map. So there's a lot of interaction, and again, this is using RStudio as kind of as a back-end tool to do the processing. But I think I'm going to stop there because we're nearly out of time. Kind of covered a lot, hopefully in a way that made sense, or at least that allows you to take next steps. Are there any final questions before, or did we cover all of what was in the chat?
There is one more in the chat. They're asking if you can provide us with any resources where we can access county and city data outside of the City of Chicago data portal. Okay, yeah, so I guess my question, this is Tiffany. I'm curious, Tiffany, what kind of data are you looking for?
Hi, thank you for the presentation. It was very informative. So I'm just looking for other data outside of Chicago. So like I went to the Cook County site, and like I really didn't find like a lot, like I don't know. So I'm just trying to get an idea, a general idea of like what data is available through the county. I guess that's my question. Oh,
for the county, yeah. Yeah, that's interesting. Yeah, obviously the City of Chicago is just pretty much going to be constrained to only, the city data. It's very rich, but you go outside the city boundaries, and then you're kind of in the dark. The most systematic and data set that's maybe uniform throughout the United States is more of the census data. Which you can get the American Community Survey, as I was showing. Are you thinking about like population or health data, or like COVID information?
So it's more like health data.
Okay.
And looking at it from the population level, and kind of, looking at it throughout the counties of Illinois.
Yeah, and you want to see variations within the county, right?
Right.
Yeah, one of the best data sets we have in terms of, one example is COVID mortality within Cook County is from the, it's from the medical examiner data. And it's really good for looking at these spatio-temporal patterns, because it has the location of residence of the patient, of the individual who died, actually. And you can look at that over time. So the City of Chicago has their data portal. You can also go to the county data portal, which is actually quite good. And you can incorporate the information into R in a very similar way by reading, a comma separated format or other format. So yeah, I recommend, if you haven't seen it or play with it, the county data portal, and they also have all of the federally qualified. They have all the hospitals and health providers and things like that. So it's a very useful dashboard for within Cook County.
Thank you.
Mm-hmm.
So we are out of time. There was one more question. If you have the link for the dashboard, if it's
Oh yeah, we're going to be sharing that and have a more formal, pilot announcement. So we'll share it very soon. Yeah, but I'll have that available too. We just want to make sure we're not editing it while people are using it. So thanks again, everybody, and we'll talk soon.